So moving on to then our third presentation of this session, and I'd like to welcome Jennifer Kirton, Thomas Mohaupt, and Claire Newey to the podium. And they are from Liverpool in the UK, and they're going to be presenting on an Autistic Communication Tool, A.C.T, for use in primary healthcare interactions, and this is a participatory research project that they will be discussing.
Right, hello. Thank you so much for having us here today, and thank you for coming to listen at this late hour on the first day. We are really excited to tell you about our Autistic Communication Tool. This is a participatory research project which we've put our heart and soul into, and it's a real passion project of ours. We have got a team, so I'm really proud to be presenting with Claire and Thomas today, but we've also got a team that couldn't come with us today that we just want to acknowledge for their passion, dedication and motivation to see this project through. So please, this is our launch of our website today. We're going to tell you lots about the tool and the thought behind it and why certain things have been included. Okay, so to start off with, I'll just tell you a little bit about the aims of the Autistic Communication Tool, or ACT, and that's a name that came up from the group as well. So it's a very, very simple patient-owned tool, and the reason that that's important is that it's not going to go missing in healthcare. It's up to you what you put in it. It's up to you who you show the tool to. But we know that in primary care, communication can be quite tricky. You've got a very time-sensitive environment, and we know that we've not spent much time in this presentation, telling you the background of why this is needed, because I think everybody knows the tricky conversations that go on in primary care. So the aims of the ACT are simple. We see it as, first of all, assisting the patient, preparing for that consultation. So the tool has some guidance notes within it for the website that's comprehensive, and it helps the patient think about some of those questions that might come up in the consultation. Also to inform the clinician about the autism diagnosis and give a little bit more information about the person, because we know that autism isn't always flagged on patient records, and we know as well you don't see the same clinician time after time, so that information is important. And also to help really direct the questioning for the reason of the appointment, so that the minute you get in the appointment, there isn't that the kind of detective work that sometimes healthcare professionals need to do to get to the reason of why you're there that day. You've already thought about the information, you've written it down, and you've given some other information, so you can turn up to the appointment and they can say, right, thank you for coming today. I can see you're here about persistent headaches. You said that they happen about once it's been happening for 2 weeks, and that direct questioning can carry on all the way through the consultation. And fourthly, really to promote an understanding of different autistic experiences. I see it as a bit of a learning snack for each healthcare professional that comes into contact with the tool. They'll think, right, okay, so I've seen a different experience of autism there, and then they might take that forward to their clinical practice. But also really to increase patient satisfaction while not overburdening clinical staff. This is based on another tool that I developed in rheumatology, and it's proven to actually not increase consultation times, but increase patient satisfaction. So Thomas is going to tell you a little bit more about the tool. Thank you.
Yes, good afternoon. So I'll briefly introduce the tool now. Claire will highlight some of its distinctive features a bit later, but basically the tool has two parts. One is to be handed in to care navigators, the other to clinical staff. Both are limited to a page. That might create a challenge for people like me who would otherwise provide lots and lots of details, but for this reason we have put thought in it to firstly structure it, and secondly to complement it by guidance, which explains you what the purpose of the various boxes is and what you should and hopefully should not put there. The use works as follows. You fill in the tool before going to your primary care provider, so in a calm environment. Use the guidance notes for help. Then when you come in, you have the two parts. You hand in one to the reception staff and the other to the clinician that you meet. And the way we tried to design it is that this will provide them with the information to act without having any specific training for the tool, and to provide you a good experience both in the waiting room and in the consultation. Let me also guide you briefly through the process. So the idea came out of Jenny's PhD, which was on adults, autistic adults aged 50 and older. She pitched it at the Liverpool Autism Hub as a kind of community interface, which allowed recruitment, which was step one, recruitment and team building. In addition to community hub, we could also use our neurodivergent staff network, and as well informally contacts that some of us had within the community with meetup groups. Then, step two, the literature review was brought to the group, and then we could add our quite diverse and lived experience to create a first draft of the tool. This was then put out for review and testing. We received 59 items of feedback, which in step 5 then allowed us to consider this, make amendments, and go on finally with step 6 to a larger pilot, and there will now be hopefully an escalating chain of pilots, feedback, and making the tool better and viable. And I think that's where I pass over to Claire.
So I'd like to spend some time just going through what the form looks like for you if you are to be completing this yourself. So at the top there is the opportunity for you to provide instructions to the care navigator, or the reception clerk, however it works in your general practice, which may help you in that waiting room area before you actually go through to see the GP or the nurse in your primary care setting. And then if you need that little bit of additional guidance to help you, we also have a box with different options that you can select if you may need to sit in a quiet area, if you might need someone to come and alert you when it's your turn to come in because you might have noise-cancelling headphones on and you can't hear the alert to look at the screen to see your name, and also an opportunity for you to share any potential signs that you may be becoming distressed because of the noisy, busy environment. We also are mindful that often appointments can sometimes not run to time, and so if you find that waiting environment very distressing or overstimulating and you would rather not be there and wait somewhere else, you can also give the opportunity to let the care navigator know how they might alert you that it's your turn to be seen, whether that's giving you a text or ringing your mobile number if you're, say, waiting in the car, for example. The next sheet is now for the clinician. If your GP is not aware of the communication tool, then there are some instructions at the top where they can get some initial information about why this person is coming in and using the tool in this setting. So it's not a necessity, although obviously it's beneficial, but it's not a necessity for the GP or the primary care practitioner to have prior awareness of the tool. The box sizes, as Thomas mentioned, are intentionally restricted in some areas. This is so that we can think when we're filling it out about providing the information in a really succinct way, so that it is quite clear for the clinician to follow that information and to get a good idea of what the reasons are why you are coming in. There's a section if you're experiencing pain or any symptoms in a particular part of your body for you to highlight where you might be feeling those, if that's something that is relevant to you. We were also, as suggested in the participatory research group, it was important that there was a section for the autistic person who's completing the tool to have an area where it can be made known what the outcomes of the session are. So what the next steps are that the clinician might be doing, and also any next steps that are important for the patient to do. If you need to pick up the forms to go and have your blood test, if you need to book an appointment with another person, or if it's a case of waiting, you're going to be referred and you're going to wait to hear from them in the future. Okay, I'm going to hand back over.
Thank you. So to finish, we have brought some quotes from information that we got back. So let me try to summarize what's my take-home message first from patients from the 2 red boxes. So from one patient, the encouraging thing is she said, my GP actually used it. And secondly, it relaxed anxiety because I didn't make sure that I remember everything because it was on the form. This certainly is something I can relate to. The other patient feedback emphasized the value in the next step box. It's also something that I find always very important, that at the very end there is a summary of actions to be taken, both by me and by my healthcare provider. Because in my experience, even if it has been mentioned, it might have not been correctly processed in my mind. Also, 2 quotes from red boxes, from GPs. So, for the first GP, the feedback was very interesting, I found. Had some training, but is aware that it's not enough, and also aware that needs are highly individual. And this GP sees a role for the tool in this context to provide them with individual information about the patient. The other GP knows from experience that autistic patients might be distressed when they finally have the appointment because of what happened before in the waiting room, and hopes that the tool can help to manage this. And now it's, I think, back to Jenny.
Thank you. So this is our website. It's live today. We're sharing it with you. And we really encourage you to visit it because the beauty in this website is it's got some feedback in it. So we want to hear from you. Is it good? Do you want some things adding to it? You know, have we missed anything out? We've also got sections, though, telling you how that we developed it, even though we've shared it with you today, some testimonials of people that have actually used it, but comprehensive instructions of how to use it as an audio format, and we've also got patient walkthroughs coming online. They're not there just yet. And also a resources section, because what we want to do is we want it to be a place where people can go to get support for their healthcare appointments. So we've got comprehensive guidance that we've developed on it, but also if you've got any suggestions of resources, and we've heard quite a few that we're thinking about putting on from this conference, which is great, but if you've got any suggestions, please just do let us know. But it's really, really important for us to get it as good as we possibly can, that we do get evaluation from people that are using it. So I'd encourage you to go on and give us your feedback. Let us know what you think. You can either go on the website and give us feedback, or you can email us directly. But yes, I think we're down to time now, but we really, really are so thrilled to be sharing this with you today. And we hope that when we look at Google Analytics later, we've got loads and loads of hits of everybody looking at it and lots of feedback telling us things that we can do to improve it. So thank you very much.
Thank you very much to Jennifer, to Thomas and to Claire. We would have time for one quick question. If anybody wants to ask a question, again, you can just come up to the purple microphone just at the top here if you do have a question. No, I'm going to ask a question then myself. I'm just interested to know that it obviously said about that if it's in the notes, it's maybe overlooked. But is it something that you would see maybe eventually could go on? Say, I know that in Northern Ireland we've moved to electronic record keeping, and it's very easy on mobile to access records. Do you see it eventually being something, or do you think it needs to be for each appointment to really draw attention to it?
I think we would definitely foresee eventually that it could move to something that is linked to one of the various types of electronic patient record systems. The next stage of what we're planning to do is to do a pilot study in a local GP practice adjacent to the university, where we can look at maybe how we can build that in. I think the potential challenges are how to manage that when there are multiple systems in primary care settings. There's not normally a universal system, and think about how best to do that. There is also the opportunity for patients to request that a flag is put on their case notes, so that when they are having those appointments, you've got that. But I think for now, until that's embedded, that's why we wanted the tool to be owned by us as the autistic individual, so that it is something that you take along and it's personal to you. Thanks.